Waiting for a needed surgery is a painful and often frustrating experience. How many people in Canada do you know that are currently waiting on a wait list for a knee or hip replacement, or a shoulder, cataract, or back surgery to alleviate chronic pain and resume their normal life's activities? If you're like me, you know a lot of people on these wait lists. Parents, grandparents, siblings, and friends. These are our loved ones, and they need care far faster than they get it now. And make no mistake, this problem is not just found in Alberta. It's as bad or worse in every province across Canada.
In fact, last year, while Alberta performed a record 318,000 surgeries and ranked second in Canada for hip and knee replacement wait times, Canada continues to perform poorly relative to other countries. In a recent survey of wait times for elective surgeries in 10 of the world's wealthiest countries, Canada finished dead last, trailing the UK, Germany, France, Australia, New Zealand, Sweden, Switzerland, the Netherlands, and even the United States. Simply put, our wait times in Canada are well above what medical experts say is an acceptable amount of time to wait for a surgery without risking other difficult physical and mental health challenges. We need to do better, and Alberta needs to lead the way.
So first, let's talk about the problem from an Alberta perspective. There are now over 80,000 Albertans waiting for elective surgery, such as hip or knee replacement, cataract surgery, or repairing a damaged muscle, and nearly 35,000 of those waiting for these surgeries have been waiting longer than clinically recommended. One challenge we face is that surgeons are not doing all the surgeries they could because the public health system can't afford the operating room time. So patients wait too long, and some frustrated surgeons leave Canada because they can make a better living in other countries, particularly the United States, where they have access to more operating room time. So let's say our public health system only has enough funding to perform 10,000 knee replacement surgeries in a year, but the wait list is over 20,000. Once the surgeons have performed those 10,000 publicly funded surgeries, they can't perform any more, leaving 10,000 people still on the wait list and well-trained surgeons not performing as many surgeries as they otherwise could. So why does the government not just spend more on surgeries? Well, that's been tried for decades, right across the country, and hasn't worked. In fact, over 40% of Alberta's budget goes to healthcare spending, which increases by billions each year as our population continues to age and grow. Simply spending more money on the problem clearly isn't working. Furthermore, the federal government and nearly every provincial government in the country has a major budget deficit. And although Alberta's deficit is smaller than we see in other provinces, it's more than $6 billion this year alone as Canada's economy enters a recession. It is clear that merely increasing government spending on this problem every year is not financially sustainable without raising taxes or charging healthcare premiums, which is not something that Albertans or other Canadians want or need right now. We need to find a solution that results in lower wait times for surgeries, doctors empowered to perform more surgeries than they can now, and no more extra taxes or fees for taxpayers. Some might say it's quite a tall order, but it's not. And most of the world's advanced healthcare systems, from France, Germany, and Sweden to the Netherlands, Australia, and Switzerland, have figured out how. It's time for Alberta to do the same. We're calling it the dual practice surgery model, and here's how it will work. The Alberta government will introduce legislation to permit surgeons and supporting surgical professionals like anesthesiologists to perform both publicly and privately funded knee, hip, eye, shoulder, and other elective surgeries. Surgeons who elect to be part of this dual practice model must commit to perform a minimum amount or ratio of publicly funded surgeries each year to qualify. So, for example, a surgeon could choose to perform publicly funded surgeries during regular business hours, while performing private surgeries after regular business hours or on weekends, should they wish. So instead of a surgeon being limited to performing, say, 1,000 surgeries a year due to health system funding constraints, that doctor could also perform an additional 200 or 300 more surgeries for patients who can afford to pay for the cost themselves, or that have an employer insurance plan that covers the cost. This greatly benefits everyone on surgical wait lists, and here's how. Those who are able and want to can pay for the entire cost of their surgery or have it paid through employer insurance plans. They will be able to have their surgery performed in the off hours and come off the public wait list at no extra cost to taxpayers. That means everyone on the public wait list moves up in the queue so that they also get their publicly insured surgery done quicker than they otherwise would. And surgeons and other specialists remain in the public system, but are happier because they get to perform more surgeries should they want to, which in turn leads to fewer of these doctors leaving Alberta and attracting back others who had previously left for better opportunities elsewhere.
The implementation of the dual practice model will be closely monitored to protect our public healthcare system. For example, we will ensure that dual practice physicians are maintaining separate records for the services they provide, so no public funding is subsidizing private services. We will also protect public workforce capacity with the ability to mandate that surgeons in dual practice must perform a dedicated amount or ratio of surgeries in the public system to be eligible to perform surgeries privately. Or we could restrict specialties to public practice if shortages would compromise public care, and potentially restricting private practice to evenings, weekends, or to underutilized rural sites as required. In addition, we will conduct regular reviews to evaluate the effectiveness of dual practice and make any required adjustments. Our government will immediately commence consultations with healthcare professionals to inform these changes and to ensure we find the right balance on this important initiative.
And to be clear, the UCP public health guarantee continues to be in full force. No one will ever be forced to pay out of pocket for a needed hip, knee, or other surgery. Everything your Alberta health insurance covers today remains covered. The only difference is you will likely get that public surgery more quickly than you do now. And surgeries for life-threatening conditions such as cancer or emergency surgeries will remain entirely publicly funded with no privately funded option available. It's time to follow the lead of other high-performing health systems in Western Europe and Japan and build a modern, innovative, and 21st century health system that attracts and retains the best doctors working in the best facilities on Earth, because healthcare shouldn't be about blind and outdated ideologies or politics. It should be about providing all Albertans with access to the best healthcare possible when and where they need it. And that is exactly what Alberta's government is going to do.